Next up, Rocuronium, or Zemuron. Also goes by just Rock. Again, this is a non-depolarizing neuromuscular blocker. Or paralytic. So what's our action? Binds to acetylcholine receptors at the neuromuscular junction, causing paralysis. Again, binds to acetylcholine receptors at the neuromuscular junction, causing paralysis. Again, non-depolarizing, so there it's just blocking the receptor, not allowing anything through, causing paralysis. So there are no fasciculations. Like succinylcholine is a depolarizing, has fasciculations or the muscle movements. Rocuronium does not have that. So again, what are we going to use a paralytic for? For rapid sequence induction, RSI. Induction or intubation. Either one, they're interchangeable, they mean the same thing essentially in this instance. No other reason to use Rocuronium for anything else. Strictly a paralytic. And what do we do with paralytics? We do not give them until we have adequately sedated our patient. We do not paralyze a patient until they are adequately sedated. How much are we going to give of Rocuronium? We're going to give 1 milligram per kilogram. One milligram per kilogram. So we're going to have to get good with weights because a lot of our meds that we're giving are weight-based. How are we going to give it? We're going to give it IV or IO. Okay. Oh, running off the board there, it looks like. Okay. What are our contraindications to giving Rocuronium? Hypersensitivity to the drug or allergy. Hypersensitivity to the drug or allergy. What are some of our adverse effects? Hypertension. Hypotension. Skeletal muscle weakness. Skeletal muscle weakness, malignant hyperthermia, and apnea. Again, apnea, skeletal muscle weakness, probably not adverse reactions for a paralytic when that's what we're trying to do. We are taking away the ability to breathe. We are taking away their ability to move. We are intentionally paralyzing these people so that we can take over their airway. Again, you're going to hear me every time I talk about a paralytic, and anytime I talk about RSI, we do not RSI a patient until we are 100% sure, without a doubt, that we need to take over that patient's airway right now, or we will lose the battle. We do not sedate, or correction, we do not paralyze until we are properly sedated. That is our patient. We do not paralyze our patient until they are properly sedated. Again, we do not paralyze until we are sedated.